Good morning, my dear friends. My name is Krishi. So today in this video lecture, we will discuss about the respiratory disorders. In this video lecture, we will discuss about one of the respiratory disorder which is majorly seen in the day-to-day life. In everywhere globally, we see this respiratory disorder, that is the asthma. In the asthma cases, we will discuss about, briefly if I will tell you, we will discuss about the definition. We will discuss about the definition. We will discuss about the etiology. We will discuss about the pathophysiology. We will discuss about the types, diagnosis, and also medication or treatment. So these all things we are going to discuss in this topic, respiratory disorders, that is asthma. So one by one we will take. So definition first. So if we see the asthma, it is a chronic respiratory disorder characterized by inflammation. So asthma is a chronic respiratory disorder characterized by the inflammation and narrowing of airways, leading to shortness of breath and other symptoms. So as we see about the definition of the asthma, so asthma is a chronic respiratory disorder characterized by the inflammation and narrowing of the airways, leading to shortness of breath and other symptoms. So it is a chronic respiratory disorder, means it is a disorder which is related to the respiratory system and it affects the respiratory system badly. So it is not going to affect as an acute. So the acute disease can be cured within a specific period of time. There is a limit of time we can cure that type of disease, acute. Within 5 days, 7 days, up to 7 days we can cure. Or without the medication also we can cure the acute disease. But here in this case, so this is a chronic disease. So this is a chronic disease. So it may lead up to more than 20 days. More than 20 days it can affect a person's respiratory system. So it is a chronic respiratory disorder, means asthma is a chronic respiratory disorder, means it harches on the respiratory system and it lasts up to more than 28 days. And also it is characterized by what happens in this? So it is a chronic respiratory disorder. In this, inflammation and narrowing of the airways will occur. So there will be the inflammation, means swelling, or we can say that redness. So there will be the inflammation and narrowing, means the lumen will be decreased. Lumen will be decreased in this. So there will be the inflammation and narrowing of airways. Airways means, so there will be the bronchioles. So there will be the inflammation and narrowing of airways, means there will be the redness or swelling and also decreased lumen of the bronchioles, leading to the shortness of breath. So this is one of the symptoms. So which leads to different symptoms. It leads to shortness of breath. It leads to some chest tightness. It will lead. So when we are going to take, for example, I want to take the breath. So when I want to take the breath, so there will be chest tightness. So the breath will be stopped here only. So we can't take comfortably the breath. So there will be the chest tightness. So there will be the shortness of breath. So there will be runny nose, blurry eyes, so itching in the eyes. So there are many symptoms that can be arising in the asthma cases. So in this, because of the inflammation and narrowing of the airways. So this was the definition of the asthma. So we will come to next phase. So this was the definition of asthma. Now etiology. Now we have etiology of asthma. Etiology in the sense means what is the cause of the disease? What is the cause of this asthma? So there are different causes of the asthma. Asthma can be caused due to different reasons. So not only one reason. So we have one reason like it can be caused due to smoking. It can be caused due to any other. So we have very up to some, but there are many causes for the asthma development. So if we see first, mostly we will see genetic predisposition. So one cause be the genetic predisposition, means in our family there maybe have any one of our family member can have the asthma case. So that can lead to the development of asthma in the newborns also. So in this case, if the parents, one of our parents or both the parents have the asthma, so there may be the probability, there may be the chance that the child, whatever be the offspring they are giving, so that can also have the asthma cases. So there may be the probability. So this is the genetic predisposition. So this is the one reason. So family history means any one of our family member can have the asthma. Next one is the atopy. Atopy in the sense means allergic rhinitis. So allergic rhinitis will be there. So we will see the allergic rhinitis. So actually our immune system, so why allergic rhinitis will occur? So whenever immune system is suppressed, or we can say that whenever immune system becomes weak immune system means our immune system has ability to fight against the antigens. So whatever the antigens which are coming from the outside to our body to affect our body, our immune system has the ability to develop the antibodies against those antigens, and it has the ability to recognize the antigen which is in favor of the body, and it recognizes the antigen which is not in favor of our body. So this is the ability of the immune system. So when that ability is going to disturb, the immune system didn't recognize, so that we call that the autoimmune disorder. So due to the autoimmunity means when the immune system becomes weak. So due to the weak immune system, any one of the allergen, we can say that any one dander, for example, if you are using the perfumes, if smell is coming from anywhere, so the perfumes you are using, anything smell is coming from anywhere, so when that smell is sneezed by that person who is having the weak immune system, so that person can be affected by the allergic rhinitis. That person can be having the allergic rhinitis, so due to those dander particles, because our immune system will recognize those dander particles as a foreign body and will lead to the allergic. So allergy, we will see exaggerated response of our immune system is called allergy. Means exaggerated response of our immune system is called allergy. Means whenever immune system didn't recognize, so what is the best for the body and what is not the best for the body, that is the harsh for the body, so that leads to the allergy. Our immune system will show its own effect. So that I don't know whatever be the things are coming and I didn't recognize, so which are the things is coming, so that will give the effect as the allergic system or respiratory system. That leads to the allergic rhinitis or asthma. This is also sort of related to this atopy. Next, in this genetic predisposition only, so next, genes are related to Ig production. Immunoglobulin E. In the further cases, we will discuss about how the Ig is going to affect, how the Ig is playing the main role in causing the asthma in our body. So Ig, immunoglobulin E, it is a kind of antibody in our body. So this will be a trigger. It is a kind of trigger. So which is going to induce the asthma in our body. So due to the genes related to the whatever be the genes which are going to produce the immunoglobulin E. So when those genes we are getting from our parents, so when those genes are defective, that lead to production of IgE, so that can again lead to the asthma cases. So that can also lead to asthma. So this is also genes related to Ig production can lead to the asthma. So I will tell you further how the Ig is going to affect our body when this is going to be released on the excess and at non-timing, when there is the no timing for the Ig production. So that time when it will be released. So how it is going to affect our respiratory system and cause the asthma. So now you will see here only genes related to Ig. So this is the first one, genetic predisposition. So if we come to the next one, so this is the genetic predisposition. So next one, environmental triggers. Next one, environmental triggers. So this is the main cause, means everyone know about this cause. So environmental triggers. So we are going to respirate, we are going to intake the air which is present in the atmosphere. So if that air is polluted, or if that air contains that undesirable substances which is not fit for our health, so we are taking the intake of the oxygen, whatever be gases we are going to intake inside, so which is useful for our body, that is going to be used in our body, but which is not useful for our body, when those things are adding in our body in an excess amount, so those may cause the asthma symptoms. So environmental triggers. Environmental triggers may be the allergens. So allergens include the animal dander. So animal dander, in the allergens, animal dander will be there, pollens will be there, dust mites will be there, molds will be there. So in the environmental triggers, some allergens will be there, means animal dander, pollens, dust mites, molds. So when those things will be available in the atmospheric air in a more quantity, which is not suitable for our health, when these things are available in the air in more quantity and the oxygen capacity in the air is less, so that can also lead to the allergy. So those are the allergic agents. So allergic agents enter into our respiratory system, leads to the asthma. So this is the allergens. Next one, air pollutants. So next one, air pollutants. So air we are going to inhale. When that air is polluted already, means that contain the undesirable things, like air pollutants include the smoke, chemicals, and other harmful effects and other harmful particles, or carbon monoxide also, that leads to further disease and disorders. So when these air pollutants like smoke, chemicals, or pesticides, or we can say that pesticides, pests, or any other things which is harmful for our body, when that things are present in the air, so when these are present in the air and pollutes that air, so that air we are going to respirate through our respiratory system. So that when enter into the respiratory system in a more quantity leads to the asthma. So that can be another reason for the asthma. So this is the second reason. So first one we see genetic predisposition, next one environmental triggers, next one in this only, and in the environmental triggers only we see first we see the air pollutants will be there, next we see the allergens will be there. So next here only respiratory infections. So next, respiratory infections. So there may be other than the there may be the bacterial infection, viral infection. Other than the viral infection, there may be the different infections which occur to our respiratory system. So when that occur to our respiratory system, means some bacteria attack our body, or mycobacterial tuberculosis we can say, or different types of bacteria are there, different types of viruses are there. So those viral infections then affect our body. Although even though those respiratory means infectants, those infectants are released from our body, but still they induce the respiratory, they induce the respiratory disorder, that is the asthma. So these are some of the respiratory infections like bacterial infection, viral infection that can lead to the asthma cases. Next one, third one. So we know that lifestyle modification, lifestyle factors. So next one, lifestyle factors. Lifestyle factors include, so if our lifestyle factor is not suitable for our respiratory system, so some of the lifestyle factors like obesity, smoking, or physical inactivity, so by my words you write, if you want to write the notes, by my words only you can write the notes, otherwise this is not visible to you, this is only for the understanding purpose. So we are on the topic. So due to genetic predisposition, environmental triggers, lifestyle factors, so the lifestyle factors includes the obesity, smoking, physical inactivity. So obesity, so when we are eating obesity, what actually obesity means accumulation of excess of fat in the triglycerides, in the form of the triglycerides. So when there is an accumulation of the triglycerides in our adipose tissue, so excessive accumulation of the triglycerides in our adipose tissue, that leads to the obesity. So by the obesity also the asthma cases can be happen. So that can also be happen due to there is some different reasons, due to the excessive mucus production that time, and also leads to the blood pressure will be increased. So more pressure will be on the lungs, in the lungs there will be more pressure, in the heart area there will be more pressure, that can also lead to the asthma cases. So during the obesity cases. Next, smoking, all of you know that due to smoking, it's simple. So smoking leads to the asthma cases also, even tuberculosis cases also. So there will be more chances. So it reduces the capacity or lung capacity. So lung capacity, there is some different peak capacity for the lung also. It is going to, smoking is going to reduce the lung capacity and lung volume also. That's why we are doing different capacity tests. So in the different capacity tests, whoever be the smoker, so his capacity test will be done, because smoking is going to reduce the lung capacity. So when the lung capacity is reduced, that can also lead to the bronchoconstriction, that leads to the asthma cases. Next, the physical inactivity. So when in our day-to-day life we are busy in the different types of works, in one place only we are doing the works with the computer or with any other, we are studying in one place only. So while studying we are not doing the physical inactivity, we are not doing the physical activity, we are eating the food, we are consuming the food, digestion is proper, everything is proper, but we are not utilizing this food anywhere. So due to the physical inactivity leads to obesity, obesity leads to asthma. So obesity, smoking, physical inactivity, these are the major cases which lead to the asthma. So these are the lifestyle modifications. Lifestyle modifications can be modified, means you can change the lifestyle modifications and that can reduce the asthma cases. You can do the physical activity, you can whatever be, if you are taking the food after 1 hour, 2 hours, you can go for the physical activity. You can burn out those calories. So whatever be the extra calories which are available in our body, you can burn those calories. So you can maintain your diet, and this is as per the diet. Next is the smoking. Smoking is injurious to health. You can quit the smoking, and that can reduce the effects of the asthma. So these are the lifestyle modifications. So next we will come for the next. So this was the etiology. Next, types. Asthma is not only one type. So asthma, it is not only asthma one type. So there are different types of asthma. So one type, allergic asthma, non-allergic asthma, non-allergic asthma, exercise-induced asthma. So allergic asthma, non-allergic asthma, exercise-induced asthma. Fourth one, occupational asthma, Next one, nocturnal asthma. Nocturnal, Nocturnal, nocturnal asthma. Next one, seasonal asthma. Etc. So there are many types of asthma. So majorly we see, so whatever be the major types of asthma, so we will see those only. So allergic asthma, non-allergic asthma, exercise-induced asthma, occupational asthma, nocturnal asthma, seasonal asthma. So these are the different types of asthma. One by one we will see. So allergic asthma. So allergic asthma is mediated, is linked to IgE mediated response to allergens. So majorly IgE mediated. So first one, allergic asthma. So it is linked to IgE mediated response to allergens. So allergic asthma, as the name indicates, so IgE mediated response to allergens. In our immune system, so there are a type of cell, that's Ig cell, immunoglobulin E cell. So when there is any entry of the allergen in our body, when there is any allergen in our body, entry of our allergen, any of the allergen in our body, so our Ig cells will be activated. So the IgE responds to allergens. When allergen enter in our body, the Ig cells are going to be activated. So the Ig response to those allergens, so leads to the allergic asthma, linked to the allergic asthma. Linked to the allergic asthma. So we see the triggers. Means what are those allergens? So which are these allergens? We see already those allergens include the pollens, dander, molds, odor. So different types of the allergens. So allergic asthma is linked to IgE mediated response to allergens, and triggers include the pollens, dander, molds, odor. Means the allergic asthma is caused due to the allergens, and these allergens are have the response in our body as IgE. IgE cells are going to be having the response in our body, are going to be activated, and those show the response to these allergens and leads to the asthma cases. So these allergens include this may be the pollens, this may be the animal dander, this may be the molds, this may be the strong odor, this may be any one of them. And when those are going to be enter in our body, so the IgE mediated cells will be activated, and those show the response. So and cause the allergic asthma. So if you see the allergic asthma, allergic asthma is most common. Means most people will see the allergic asthma. So because the pollens may be in the environment, so there is no reason. Then anyone can use the dander, means anyone can use the perfume. The person may have the difficulty in breathing while anyone is using the perfume. Anyone has the weak respiratory system, so it's not, he didn't want the, he's having the, doctor is telling to him, so he's having the perfume allergy, or he's having the allergy with the dander, smell allergy, due to any strong smell he's having the allergy. So that's also, there is the allergic asthma. Means due to the pollens, due to the dander, due to the animal molds, due to the strong odor, the IgE cells when enters in his body, the IgE cells are going to be activated, and that leads to the allergic asthma. So there is the allergic asthma. That's why it is the common. So symptoms. Separately we see for every type we see separately symptoms. So symptoms include runny nose. Symptoms are important. Runny nose, itchy eyes, dyspnea, means shortness of breath, runny nose, itchy eyes, dyspnea, that's shortness of breath, Next, wheezing. So if you see the symptoms, everywhere you see the wheezing sound during the night when the person is going to sleep, especially he sleeps at night. So during the night time, the wheezing sound, the person evolves as a wheezing sound. From the person's mouth, the wheezing sound will evolve. So the wheezing sound, you see the major symptom of the asthma. If you listen from anywhere, the person is having the wheezing sound during the night. The person may be having, the probability is more, the person may be having the asthma cases. The wheezing sound is more. So this is the major reason. Next, runny nose, itchy eyes, dyspnea, shortness of breath, and shortness of breath is also there. Wheezing sound, wherever be the wheezing sound, shortness of breath will be definitely. So those two symptoms will be definitely wheezing sound, shortness of breath. And in this case, allergic asthma, runny nose will be there, itchy nose will be there, and these are the major symptoms in this. Different types of symptoms in this. So runny nose, itchy eyes, dyspnea, shortness of breath, and wheezing sound during the night times. So these are the symptoms of allergic asthma. So we will go for the next type. Non-allergic asthma. As the name indicates, non-allergic asthma. So it is not caused due to the allergens. So it is caused due to the irritants. So cause is the irritant. So it is not caused due to the allergens. So it is caused due to the irritants. Irritants include the cold air, dry air. So inhalation of the cold air, inhalation of the dry air. Next, smoke. So there are some of the reasons. So irritants, or we can say that dust also, or chemicals also. So in the non-allergic asthma itself telling, so as the name indicates, non-allergic asthma is not caused due to the allergens. It is caused due to the irritants like cold air, dry air, smoke, etc., chemicals, etc. So when we are going for the exercise, for example, so the patient is having the weakness in his immune system, he is going for the exercise. So during the harsh exercise, so he's exhaling a lot of air. So that time the respiratory system works more. So that time, if there is a season like cold air is there, or if there is a season dry air is there, if there is a season smoke will be more. So those act as the irritants, and that leads to non-allergic asthma. So these are some of the triggers which lead to the non-allergic asthma, and these are caused by the irritants, and it's why it's called the non-allergic asthma. It is not caused due to the allergens, it is caused due to the irritants like cold air, dry air, smoke, or dust or chemicals. So these are some of the reasons. Next, if we see the symptoms include the same. So coughing, consistent coughing, consistent chronic coughing. So we see the patient is having the consistent chronic coughing, means after every second, means when he want to talk, the coughing is coming definitely. Like he want to talk, the coughing is coming. He want to talk, coughing is coming. He want to do some activity, the consistent chronic coughing is coming. So that could affect his all ribs. The rib cage also is going to affect. So the consistent coughing will be there. Consistent chronic coughing will be there. Shortness of breath. Especially in this we see the chest tightness. First of all, we see the consistent chronic coughing. Next, chest tightness. Chest tightness will be more. Means he is having the cold air he has inhaled, or dry air he has inhaled, or smoke air he has inhaled due to the irritants. So he is having the consistently coughing, and also the chest tightness. So he want to take the breath easily for the proper relief. He want to take for a relief purpose. He want to take the breath, but he is not been able to take the proper breath. He is having the chest tightness. Because of the bronchoconstriction. So in this case, you see the bronchoconstriction. I saw already in the asthma, it's characterized by the inflammation and narrowing of the arteries. When there is a narrowing, there is the bronchoconstriction. Means the lumen of the bronchioles are going to be decreased. And when the lumen is decreasing, so the capacity of the arteries, the capacity of the lungs is going to be decreased, and less amount of air will be there. You want to take more amount of air, so that time only the bronchoconstriction will occur. Already the space is less, so the person want to inhale or exhale the air, so that time he is feeling the chest tightness, means he is feeling the angina attacks. Angina attacks means severe chest pains. He is facing the severe chest pain in the chronic attacks. In the chronic case, he is feeling the angina attacks. So this is the non-allergic asthma. If you see here the mechanism, so the Ig mediated mechanism is not working here. So the different type of mechanism is working here. Ig is not working here. So in this Ig mechanism, IgE, immunoglobulin E mechanism is not working here. In the first we see immunoglobulin mechanism will be there. But here in the non-allergic asthma, Ig mechanism will not be there. In place of IgE, so in the IgE, in place of IgE, so eosinophils in place of neutrophils will be produced. Eosinophils in place of neutrophils will be produced. So the neutrophils should produce, so that can reduce the asthma cases. So, but in place of eosinophils, in place of neutrophils, eosinophils will be produced. So in this mechanism we see mostly the eosinophils will be produced. So this is the non-allergic asthma. So next one is the occasion exercise-induced asthma. So next one is the exercise-induced asthma. So due to the more exercise, harshful exercise, due to more demanding exercise, as your respiratory system didn't want that type of exercise, so vigorous exercise, so that can also lead to the asthma cases. So exercise-induced asthma. So due to the high demanded exercise or workload, due to the high demanded exercise or workload, so that can lead to the asthma. Because in the exercise-induced asthma, so you are doing the more exercise. When you are doing the more exercise, the air, the oxygen supply inside it's increased, and the demand is also increased. So our respiratory system is going to be efficiently. For some time it will work for 10 minutes. Sorry for the disturbance. So so a person can do the exercise easily for 10 minutes, 20 minutes, 30 minutes. After 1 hour also he can do, but more than enough he can't do. So because the more overload to our respiratory system, when there is a more overload to any part of our body, so that's going to show the harmful effect. For example, if I do the exercise for this for longer period, for 1 hour I can do, for 2 hours I can do. So after 2 hours it will be, so there will be more blood supply towards this. So there will be the swelling or inflammation will be occur here. So in the same way, when we do the more exercise, so there is a more oxygen supply and more demand of the oxygen will be there. So heart is also affected. So you will get the angina attacks by that also. So bronchoconstriction also gets by that. So that's the high demand, excessive demand of the oxygen inside our body due to the exercise leads to the bronchoconstriction. More efficiency means whatever be the efficiency capacity of our respiratory system, that's going to be reduced because you are taking the more oxygen demand will be there. So there is no chance, there is no 100% chance the oxygen will be pure. The oxygen can be impure also. When you are taking more oxygen demand is more, supply is also more, so that time our efficiency of our respiratory system reduces and the bronchoconstriction will occur. That leads to asthma. So the symptoms will be in this we see the acute angina or chest tightness we will see, shortness of breath, Acute angina, shortness of breath. In this also wheezing you will see, but night time or morning time. So these are some of the major. So I am telling the major. So there are different types of, there are many symptoms which arise due to the excessive or due to the exercise induced asthma. Majorly I am telling. So acute angina, shortness of breath, wheezing sound during the night or at the morning time. Night or morning time, not the full day. So these symptoms may arise. So this is the exercise induced asthma. Next one is the occupational asthma. Next one is the occupational asthma. In the occupational asthma, so occupational asthma arises due to the when a person exposes himself towards the different triggers in the workplace. So exposure to triggers in workplace. So when a person exposes himself towards different triggers which may induce the respiratory disorder, that is the asthma in the workplace. So that is called the occupational asthma. Occupational itself is telling means workplace. In the workplace, when a person exposes himself, when a person is exposed to some triggers which may lead the asthma in the workplace, is called the occupational asthma. And the reasons may be dust may be there, dust fumes may be there, chemicals may be there. So dust, fumes, chemicals, allergens, so different types of things may be there, so that can induce the asthma in that person which is working in that industry or in that workplace. So when the person is exposed, so due to the dust, fumes, chemicals, so that leads to the occupational asthma. So if you see the symptoms will be same as that of general asthma. Symptoms will be same. He is having the consistent coughing, he is having the breathlessness, he is having the chest tightness, he is having the more mucus production. So different symptoms will be there. So we will see the further symptoms will be the same. So next one is the nocturnal asthma. In the occupational asthma, there will be the lung capacity of the person is going to be reduced. In the nocturnal asthma, so asthma worsens during the night time. During night time. Nocturnal asthma. So it is a type of asthma which worsens. It is a type of asthma whose symptoms worsens during the night time. So that is the nocturnal asthma. It is a type of asthma whose symptoms worsen during the night time. Night time is going to be worsened. So this is the nocturnal asthma. So in the nocturnal asthma, the lungs function decreases during night. So in the nocturnal asthma, we see the lung function of a person decreases during the night. So in the daytime, we can see. So if we want to take the breath, so if we want more efficient oxygen, so we know that we want the oxygen. So by our wish, by our will, we can take the oxygen. But during the night time, this is the autonomic function. Your respiratory system, your heart, your different systems are going to be, some of the systems in our body are going to be work autonomously. These are going to be work by their own, by not knowingly. We want the oxygen supply or different. So we are in the sleep. So that time it's going to be work by its own. So that time the lung function will be reduced. When the lung function will be reduced, definitely when the lung function will be reduced, there will be less sleep. Sleep will be less. So insomnia issues will be there. Sleepiness will be there. Next, consistent coughing will be there. Wheezing sound will be there. So this is the nocturnal asthma. So as you see in the patients, nocturnal asthma patients, so they are having the more worsening conditions of the asthma at the night time when they want to sleep. So during the sleep time only they are having the asthma. Asthma symptoms more arises during the night time only. So that is the nocturnal asthma, because the lung function decreases the lung capacity, the lung function decreases during the night time only. So that's the nocturnal asthma. Next, last one is the seasonal asthma. So seasonal asthma. Seasonal asthma, as the name indicates, so seasonal asthma occurs due to the different types of the seasons. So it arises or it triggers in our body due to different types of seasons. Due to different types of seasons. So why due to different types of seasons? Because some of the seasons are there, or we can say that cold seasons are there, or dry seasons are there, summer seasons are there. In some places, different types of seasons are there. So during those seasons, so there will be the excessive moisture. When there is excessive moisture, so it may include the allergens, then pollutants. So when there is a moisture is more, means the moisture will act as a carrier. Moisture will act as a carrier of the allergens, then pollutants. When the pollutants will be more, or when the allergens will be more, so due to the hormonal conditions also. So hormones means different types of things, means pollutants will be more also. So that leads to the in the excessive moisture. So that leads to the seasonal asthma. So some persons have asthma symptoms are arising during some seasons. So when the rainy seasons comes, so then the atmospheric moisture will be more. So due to the atmospheric moisture, their symptoms worsens during the these different types of seasons. During the rainy season or during the summer season, their symptoms are arising. So that is called that is the seasonal asthma. So in the seasonal asthma, so different symptoms are there. So if you see, the itchy eyes will be there, burning sensation in the eyes will be there. So there will be the fatigue conditions will be there. So some of the symptoms will be there, breathlessness will be there, chest tightness will be there, running nose will be there. So different symptoms will be there. So these are the types of asthma. So we see one by one types of asthma. So first of all, we see the allergic asthma, non-allergic asthma, next exercise-induced asthma, next occupational asthma, next nocturnal asthma, next seasonal asthma. So 6 types of asthma we see briefly.